Hi guys, today we are going to study a very important topic of microbiology. In fact, it is the most important organism and the first one to study when we go for the textbooks of microbiology. So today we are going to talk about Staphylococcus aureus, and first of all we'll talk about the major features of Staphylococci. These are facultative anaerobes, as you can see on the screen. Facultative means they have ability to live in the presence of oxygen and can also survive in the absence of oxygen. These are cocci. You mean you know that these bacteria are round, round shaped, and occur in clusters like the bunch of grapes. Staph aureus. These bacteria are non-motile and do not form spores. Okay, Staph aureus is a member of the Staphylococci family, and here we can see on the screen that Staphylococci bacteria are non-motile and these do not form spores, non-spore forming bacteria, and are non-motile. Okay, then we'll move on to the properties and features of Staphylococcus aureus. Here you can see on the screen that this is coagulase positive. This ability helps the bacteria to move inside the blood clots. It can move across the blood clots and it helps in the spreadability of the bacteria. Okay, we'll go through this topic very fastly, and this will help you revise and also retain the information. If you can even listen to this video, it will help you retain the information for a long time. You can watch it again and again too. Okay. Staphylococcus aureus shows the small yellow or golden colonies on the blood agar due to pigment staphyloxanthin. So you can see that staphyloxanthin is the pigment which gives this bacteria the ability to show the yellow or golden colonies on the blood agar. You can see here it is the blood agar. Okay, staphyloxanthin. It is beta hemolytic. Beta hemolytic. We know that when in the chocolate agar we grow these bacteria, we make the culture. It gives the complete hemolysis. It ferments mannitol on the mannitol salt agar. Reason why normal flora of the nasal mucosa and skin. It is the normal mucosa of nasal mucosa. It is found in the vestibule of nose in all the humans, mostly of humans. The transmission is by hands and sneezing and surgical wounds with food, with custard, potato salad, canned meat, Sam, as you can see on screen. And 90% of Staph aureus are penicillin resistant. So it is predetermined as of today that most of the Staph aureus bacteria are already resistant to penicillin. Okay, we'll move on to the pathogenesis. Here you need to retain the points given in bold. Protein A inhibits the oxidation, binds the Fc component, which is the fixed component of IgG antibody, and prevents the phagocytosis. This protein A, it prevents the phagocytosis of this bacteria because it binds the antibody and the fixed component Fc component of IgG. Okay, polysaccharide capsule. Polysaccharide capsule also helps in the phagocytosis. It prevents the phagocytosis and lets the bacteria live. Toxic shock syndrome toxin. This is a toxin of Staph aureus. 1. Superantigen binds the MSC2. MSC2 is a protein we know. This MSC occurs on the surface of all the antigen presenting cells in the human body. MSC1 is meant for the self antigens, while MSC2 is meant for the foreign antigens. We'll move on. Coagulase converts the fibrinogen into fibrin clot, can hide out in the blood clots. Okay, we know here that this coagulase can hide out in the blood clots, so we know thus that this bacteria is able to hide inside the blood clots. Alpha toxin, cytolytic toxin that forms the pores, hemolysis. It causes the hemolysis of blood. Exfoliatin protease that cleaves the plasmogline, epidermolytic. We know that it causes the scalded skin syndrome, bullous impetigo. So in the newborn babies, the skin is damaged, and the reason behind that is the Staph aureus causes the it breaks down the plasmogline. Thus, we know this it causes the lysis of epidermis. So it is epidermolytic. And enterotoxins, which cause the inflammation inside the bowel, intestines. Superantigen, fast acting and is heat stable. It is not destroyed by heat, and this causes the food poisoning. We know that whenever the food is which is mainly based upon the milk, like curd, is kept for more is eaten after 4 or 6 hours, it causes the formation of this toxin, and when it is ingested, it causes the disease. PB leukocytin is also an important virulence factor, helps in the pathogenesis, an important virulence factor for the CAMR This means that methicillin-resistant Staph aureus and destroys the leukocyte spore-forming toxin. It causes the destruction of leukocytes and helps in the pathogenesis. We'll move on to the diseases caused by Staph aureus. So first of all, we know that it causes the exfoliating. It contains the exfoliatants and is epidermolytic, and can also hide inside the clots. So it causes the disease of skin. Impetigo, erythematous papules, and woolly blisters with clear fluid are found. In scalded skin syndrome, diffuse epidermal peeling, which means the destroying of keratinocytes attachment in the stratum granulosum. We know there are 4 layers of skin. In the stratum granulosum, it causes the detachment, so the upper surface of the skin is peeled off and is destroyed. Formation of abscess and mastitis, subcutaneous tenderness, redness, swelling, central necrosis usually drain to outside furuncles and boils are formed due to Staph aureus. Abscess, you know that is a lesion in which the pus is formed, and mastitis. We'll move on. Surgical infections. Most common cause of surgical infection is Staph aureus. It causes the fever with cellulitis. Folliculitis is also causes. It is the most important cause. Folliculitis is the inflammation of hair follicles. If we move on to the systemic infections, it causes the toxic shock syndrome, wherein the fever, hypertension, sclerotiniform rash, particularly on the palms and soles, is seen. Innumerable small red papules diffusely distributed with multi-organ failure. It is called toxic shock syndrome. You can see there is fever and hypertension like anaphylactic shock. Just we can also see in here that sclerotiniform rash is formed on the palms and soles. Infective endocarditis, it is the second most common cause. Overall is in the IV drug abusers, it is the first cause, while it is the overall second most common cause in acute settings, which gives the fever, malaise, the feeling of unwellness, leukocytosis raised in lymph white blood cells, heart murmurs with the tricuspid regurgitation. While for pneumonia, we can see salmon-colored sputum, rapid onset, high rate of necrosis, high fatality. It also causes pneumonia wherein salmon-colored sputum is formed. Most common post-influenza infection is also seen with the Staph aureus. In the elderly people, rapid for the 2 or 3 days. Also is associated with nosocomial ventilator, IV drug abusers, congestive cardiac failure, and CGT cases. Okay, while for the pneumonia, we see that salmon-colored sputum is formed. It is the most common cause of influenza in old people and is associated with hospital-acquired ventilator pneumonia, and also in IVD drug abusers. Osteomyelitis is also causes bone pain, fever, redness, lytic bone lesions on the imaging. It also causes gastroenteritis, as we have seen enterotoxins are formed and superantigens. It causes this is due to preformed toxin. As I've already told you about the timing, 2 to 6 hours after ingestion, prominent vomiting, watery, non-bloody diarrhea, nausea and abdominal pain. Preformed toxin is ingested, which causes gastroenteritis. You can see custard, potato salad, canned meats, and may also be the cause of Kawasaki disease. While for the treatment, we can see in here that dafiziline or oxacillin are not given in here. These both penicillins are penicillinase resistant and are not destroyed by penicillinase enzymes, while for the MRSA strains, which are methicillin resistant Staph aureus, vancomycin is administered, and those which also get the resistance to vancomycin, we can give quinupristin, dalfopristin. These are streptogramins, and an isolator can also be given. Gastroenteritis is self-limiting. That is all for tomorrow, for today, sorry.